The best part of my day is when I walk through the doors and I know that my purpose is to make sure that I'm doing my best to take care of the patients that are here. And by doing that, I'm usually taking care of the caregivers. I'm a nurse first and an administrator second. And I hope that all of our providers and our physicians and clinicians see that and feel that every day.
If you ever have an interaction with Tammy, at the end of that interaction, you feel like you've been heard and like something is going to be done. You leave that interaction feeling better than when you walked in the door, and sometimes it changes your whole day.
Tammy has a natural presence about her that I think she's unaware of. I can almost see her laughing at me saying this, but Tammy is unaware kind of the force of her personality, how effective she is. Most of us, when we become aware of a virtue, start to play to our own balcony, and Tammy never does that. She's just uniquely and genuinely herself.
You know, Tammy is a former behavioral medicine nurse, and so she can use those skills to engage people and help them work through some of their challenges. Her leadership skills, her tenacity, her engagement has helped her be very successful and has helped change not only St. Anthony, but this entire community.
When I think about hospitals, not just our hospital, but all hospitals, they're really just bricks and mortar, and it's really the people that make our hospital come to life.
Doctors aren't the easiest people to deal with, and Tammy has a heart for healthcare workers, a heart for physicians that I think is quite remarkable.
When I think about my proudest moments at St. Anthony Hospital, I have to say it really is about our response during crisis situations. We had the Oklahoma City bombing, we had a couple of tornadoes, and then most recently the pandemic. Since then, we have discussed the naming of our own employees, and we call them Saints in Action because that's what they do. Every time the city needs caregivers, our employees step up, and they are Saints in Action.
I will say she's made practicing medicine, which is very difficult, a lot easier because she's there. She has your back, and most of all, she wants to take care of the patients.
Healthcare is never boring. That's the other thing I like about my job, which could also be a challenge. The problems that I'm dealing with today are probably not going to be the problems I'm dealing with in a month, and that is really exciting. I'm never the smartest person in the room, but I'm smart enough to know that I'm not, and I surround myself with really smart people that share the philosophy that patients come first, and that's how we pursue healthcare at St. Anthony.
When I think about the spirit of this award, Tammy comes to mind because she provides leadership for one of the largest health systems in our state. But as she is leading, she's also thinking rural. And there's so many things that impact rural. And so for her to understand and promote and advocate for some of the most rural areas in our state, to me, embodies that the sum of its parts is what creates the whole.
Tammy, being from Henrietta, also understands the need for us to, as leaders, even though we're really focused in Oklahoma City, to get outside the walls of Oklahoma City and outside of St. Anthony to see what's going on in rural healthcare. And I think Tammy has always been a huge advocate for those communities and those leaders for healthcare in rural Oklahoma.
Tammy comes from a small town, just like I do. And I've read before where she talks about her Henrietta values. And that's really important in healthcare. She's trustworthy, she's hardworking, she puts her patients first, she puts her team members first, and that's just an incredible skill and an incredible blessing to the community that she serves.
I wouldn't have been at the table if it hadn't been for OHA. And the things that I learned through OHA gave me the confidence to be able to sit at the table to tell our story, which has made such a tremendous difference for Oklahomans.
When thinking of Tammy's time here leading the OHA, we faced some huge challenges. So leading us through the ACR and bringing in over $500 million to our state and creating that stability for our health systems, I'm so thankful she was at the helm for that.
Tammy has had significant influence on what we're doing today and what we're going to do tomorrow. And our focus on improving health and healthcare, our strategic priorities of workforce and talent development, on public trust and member engagement, and healthcare transformation, Those are all areas that Tammy helped to foster that discussion and to advance at the board level.
And what we've been able to accomplish in the last 5 or 10 years through OHA is our strength in numbers and our ability to agree and come to consensus to ensure that healthcare is viable for the future. The support of my family is essential in doing what I do every day, and I have the greatest husband and children who probably things that I've missed that I shouldn't have, but have always been forgiving of me. They attend all of my events, whether they want to or not, and it's your family is why you do what you do. And having your family support when you have a career that you've loved makes all the difference in the world, that when you're gone, you know that they understand. Receiving this recognition by OHA is really very humbling. When you look at the list of past recipients, those are really the icons of healthcare over the years. And so I'm really grateful to be a recipient of it. It makes me know that I've been doing something right, but it also sets a challenge for me to continue to exude those standards that Cleve Rodgers did. Occasionally, I get to walk by and talk to patients, and they get to tell me their stories of why they're here and the difference that our physicians and our staff are making in their lives. And that makes all of it worthwhile.